Have you ever had to wait for a very long time to get care at your nearest emergency room? Today I'm sharing one surprising reason why that can happen. Let me take you behind the care entrance of the ER and tell you the inside story. Patients just like you need a smooth, accessible healthcare journey. I'm Jim Wiedrick, an ER doc, and I'm here to explain the system, point to the problems, guide folks on a better path to improved health for you and everyone you care about. I used to work inside the system, trying for fixes there, but progress was glacially slow. Very often, the problems in our healthcare system are obvious to experienced insiders such as myself, but fixes are blocked by a smothering bureaucracy and a lack of political will. Well, I'm for taking action, and education is the first step. Thanks for being here. Come along with me to one of my recent ER days. Clock says 7 a.m. Oh, 700 on a Saturday morning. Staff are all arriving for the day shift. I'm signing into my computer and listening to the nursing group doing their patient care handover from the night shift. The overnight doc is at her cubicle doing charts, and I nod to her. She looks tired. I sense she just needs quiet. The staff handover conversation immediately points to the challenge we're all about to face. The issue of access and flow. We're gonna have less than half of our usual beds and half of our usual space to work with for all of the emergency room issues of the day. I mean, we're designated as having 8 regular ER beds, but of those 8, there are 6 we can't use. 6 beds filled with patients who've been admitted to the hospital and yet have nowhere else to go. Shift supervisor shares that, there are no open beds out of the 30 that are up on the medical floor, and none of those beds are expected to open up later today either. There just won't be any discharges. So as the patients line up to be triaged for ER visits, as we look at it, we're going to have to make the most of our 2 regular beds left, the 2 trauma room beds, and 4 chair spots. So that's what we have to keep patient flow, to observe, to treat sick folks. Those will have to do, and when they are full, non-life-threatening cases will have to wait. Hey, I work in a small Canadian emergency room that serves a population catchment of 30,000 people. So let's pause and be clear about one point. My ER does not have it as bad as the major metro centers in our nation. Just last month, we learned about a tragic case in an Edmonton hospital where a 44-year-old male presented with chest pain and ended up waiting more than 8 hours. He died before a proper doctor assessment or any meaningful treatment. How does that happen? Well, that particular case is under a judicial review, and I'm not going to speculate. But let's talk big picture about why Canadian emergency rooms are under strain. Well, basically, emergency room departments are the pressure relief valve for the entire system. Too many people need to be admitted to a hospital? No space available on the regular wards? Okay, then. The admitted patients have to stay in the emergency room. Why aren't there enough beds on the regular wards? Well, because Canada is cheap when it comes to beds. Take the total number of beds available in hospitals, divide by our population, and we rank 25th out of 30 countries. And that doesn't even account for the fact that we're a really spaced out nation. Lots of geography. And in other news, often what regular hospital beds we have are filled with frail elderly who have no open long-term care bed space to move into. And why is that? Because we do not have enough long-term care beds. We ranked low on per capita long-term care beds, and our population is aging rapidly. That is not a good mix. So the dominoes fall one after another. There's a sequence. One issue leads to the next. Et voila! Your ER wait time often depends on long-term care bed availability. When you are sick or have an emergency, you want to see a doctor and get treatment as soon as possible. The average citizen doesn't want to have to philosophize or scratch their head or do analysis in those moments. But the brutal truth is that for the emergency room to function as it is designed, it needs to have all of its resources available. Running an emergency department with many of the beds already occupied is a lousy practice, but it happens all the time. The irony of the day I introduced you to is that we had to admit to our hospital a couple of really sick people from long-term care. It just never ends. Canada needs to build the infrastructure. We need to escape the big bureaucracy, and the time for tinkering is over. Let's create the system we all need and deserve. Next week, I'll offer a solution. Hit subscribe. I'll be back, and together we can learn about a potential fix. Until then, stay hopeful.